Okay, let's talk about the male side of things real quick. So, we actually do have some really fascinating research and how sleep impacts sperm specifically. So, we see in the literature that men who sleep less than 7 hours a night typically have lower levels of testosterone and lower sperm concentration. And then we take that same group of men, we make them sleep just for 1 more hour. So it's not this big, huge change. 1 more hour of sleep, and there's a drastic improvement in both testosterone and sperm concentration. So we're seeing a direct correlation not only between low quality and low hours of sleep impacting the amount of sperm that are available, but also impacting hormone production. And it's likely the hormone production that is then in turn impacting the health and quantity of the sperm. And this is a big one for men because women typically, not always, but typically are, I feel like women just intuitively know they need more sleep, right? And so they're less likely to like self-sabotage their sleep, whereas men typically are more like identifying with the concept of being a night owl, right? Like oftentimes men are like, oh, I'm a night owl. Like it's normal. I stay up till 1. I'm fine. It's always been like this. But they're also not feeling like the best version of themselves. And why is that? Because they likely have low testosterone from years and years and years of poor sleep. So the same principles in terms of sleep hygiene for women, they are true for men as well. Same time of bed. We want to have a good sleep hygiene routine going into bed. So low screens, if we can, block that blue light. If you can, have a bit of a wind down routine, get into bed in a room that feels ready and comfortable for sleep, and give yourself an ample amount of time to get that deep sleep. And knowing that we do our best deep sleep between 11 p.m. and 2 a.m., we don't want to be going to bed at midnight or 1. We're really losing out on that opportunity to get in that deep, restorative, and restful sleep. And if you know already, if you've had a semen analysis done and you know that concentration is low, and we are on a laundry list of supplements, but you're not sleeping well, you're not exercising, you're not eating super well, we're not managing your stress, those supplements really aren't going to do anything for you because we're not laying the foundation. We have to set that foundation for health before we can really get anything out of all the stuff you're spending money on. And sleep is a big piece of that. And so from a hormone perspective, we have that direct correlation from a fertility angle with lack of sleep, but it's the same kind of cortisol disruption that we talk about with women that we can see with men. It can still have a big impact on the nervous system and your body's cortisol factors and the metabolic health piece. We're humans are humans, whether they're men or women, glucose and insulin, it's all the same. So similar to women, if we're not giving adequate time for our body to use that glucose and insulin, we're potentially worsening insulin resistance. We're potentially increasing blood sugar dysregulation. And we also have the literature to support that metabolic health piece being a factor for male fertility, and not just sperm quantity, but quality as well. We're seeing increase in DNA fragmentation, in motility, and in morphology issues when we have metabolic health issues.